Our poster and research focuses on hypoglycemia, and the purpose was to look at the effects of hypoglycemia on cost as well as the length of stay that patients had in the inpatient setting. What we focused on was trying to see if the number of hypoglycemias prolong the duration of the length of stay and subsequently the cost of the length of stay. This was a retrospective kind of a study where we looked, it was all done in a single academic institution, and we looked at almost 46,000 patients who were admitted with diabetes, with hypoglycemia, and who were treated with insulin. And we narrowed that down to patients who had severe hypoglycemic events. The patients who had severe hypoglycemic events, it turned out was a small fraction of that big number, but nevertheless the costs associated with that small fraction of patients was significantly higher. So with each increase in the hypoglycemic event, the cost of the stay went progressively up. What we found was that with a single episode of hypoglycemia, the cost of the stay was up almost by $30,000, and this progressively went up with each subsequent hypoglycemia. And what we also found that was more hypoglycemia was a predictor of a longer length of stay, a longer duration of stay, as well as increased cost. And what we found was that predictors of hypoglycemia were that if the patients had one hypoglycemia, they were more prone to get more hypoglycemic episodes. Well, whether this was a cause or whether it was just an association remains to be found, but that was our initial preliminary findings. There have been other studies in the past that have looked at patients who came in with hypoglycemia and the costs that were associated with this, but with this particular study, we looked at patients who were admitted for various other reasons, not just for hypoglycemia, but a vast majority of them had diabetes. So we focused on patients who had diabetes, who were treated with insulin, and that was the big focus of this study, was insulin-treated diabetic patients. And we looked at the hypoglycemic events in that subgroup of patients. It's probably not a cause and not an association. It could either be one or the other, and it seems like as patients are more prone to hypoglycemia, it behooves providers to kind of administer insulin in a safe fashion, and probably a computerized model or a protocol-driven administration of insulin is what's suggested. It probably is very cost-effective also to do a protocol-driven or a computer-based insulin administration protocol. For now, our focus was mostly on the hospital side. It was inpatient. So just based on this study, I can say that this is a hospital-based protocol and hospital-driven protocol rather than an outpatient. But I'm sure it's probably applicable to outpatient as well, because our study looked at inpatient costs. So we haven't looked at outpatient costs, but I'm sure that outpatient costs are pretty significant, even for patients who have hypoglycemia on the outpatient end, with all the emergency room visits, the doctor visits, and so forth. So it's probably applicable to both, but our study pertained mostly to inpatient hypoglycemia. We're going to do a sub-analysis of these patients, trying to see what were the factors that caused these patients to have hypoglycemia. The other big issue is, was this a cause? Was this an effect? Was this just an association? So that kind of remains to be seen. And also, prospectively, we might be looking at maybe safer mechanisms of delivery of insulin and a more targeted and a more calculated approach to insulin, which will prevent hypoglycemia and thereby save healthcare system a huge amount of money in terms of their care for diabetes patients. It'll be exciting to see the sub-analysis of the patients who had hypoglycemia and a more prospective type of a trial.